My name is Maria Ritten. I'm working with Kate Perry and Mary Grace O'Shea on debriefing frightening current events in the elementary classroom. So first we want to define what the problem is. Basically in recent years, gun violence has become an increasing problem in the United States. And actually in 2020, it became the leading cause for the deaths of children and adolescents in the United States. This is obviously a very upsetting problem. And in tandem with the fact that children are increasingly exposed to the news of violent events through things like social media and other news outlets, this is creating just a really difficult situation for teachers specifically. And I know all three of us, as teachers this year, we all dealt with situations when our students mentioned difficult topics in the classroom. And so we were wondering, how are we supposed to respond to this as teachers? What are best practices? First, there has been research done about how teachers approach talking about difficult problems in the classroom. In that research, it was found that teachers feel confident in their ability to provide support to children, but they feel inadequate when it comes to finding a balance to support the different needs of kids. And then in this study, they also determined that teachers are really looking for better knowledge and skills to help their students, and basically to help them manage both their students' emotions, but also their personal teacher emotions after experiencing trauma. So when we came up with this idea, we were asking a few different questions. Our first is it effective and helpful for elementary teachers to address questions about violent or traumatic events in a whole group setting? Then we were asking, how can elementary teachers thoughtfully speak about these events in their classrooms? And if they shouldn't be debriefing in a whole group setting, how can they address their concerns? Because these topics are coming up.
So we wanted to start off by defining what we mean by a frightening event. So according to the CDC, a traumatic event is defined as any event or series of events that causes great stress to a person and is marked by a sense of helplessness or anxious feelings and some sort of threat or of injury or death. And traumatic events may not necessarily affect only the victim or the survivor of that event, but also the family, the rescuers, the people surrounding that event, whether directly or indirectly affected. And a person's response to a traumatic event can vary greatly in both their physical and emotional responses and the duration of those responses as well. And so in knowing this, as teachers, we must consider whether or not it's helpful to debrief traumatic events in a group setting, especially in elementary classrooms. So as Maria mentioned, there's a discussion as to whether or not group debriefing is a best practice for discussing frightening current events in the classroom. And so there are arguments that are both for and against this practice, yet we found that many studies are focused on adults rather than solely children. So keeping this in mind, I would like to mention specific forms of debriefing that argue for group debriefing, that it's helpful rather than harmful, and also mention some studies that talk about how it may not be the most helpful practice, harmful for students in an elementary classroom after exposure to some sort of traumatic event, whatever that event might be. So a specific type of debriefing that many studies focused on is called critical incident stress debriefing, CISD, as you can see on the slide. And it's a treatment that's designed to prevent symptoms of PTSD and other anxiety or stress disorders after victims and survivors are exposed to traumatic events and extreme stressors, according to Lilienfeld in her research. So most often CISD looks like a 3 to 4 hour long single session therapy that's conducted in some sort of group setting within about 24 to 72 hours after a traumatic event, whether the patients are directly or indirectly involved in the incident. So there was a study that we found that's also mentioned on my slide, which found that CISD is majorly ineffective in avoiding PTSD symptoms, as it may hinder a victim's natural recovery processes. So because it's so soon after the event occurs, it may not help the patient in the long run, as it's happening so soon after they've experienced that event. And additionally, that research, McNally's research, also found that for some survivors, interventions that involve debriefing can disrupt their own social networks of support. So through family, through friends, through loved ones, and through other networks of support, and then cause them to take on the experiences of other survivors that are in their group debrief session as their own, which can cause a whole slew of problems in their process of dealing with that traumatic event and in coping. And so while these research found that CISD is likely a harmful treatment for those who are exposed to extreme stressors, it's also important to note, like I mentioned earlier, that these studies are primarily focused on adults. So there's a huge lack of research in the field of looking at how group debriefing affects younger children, particularly in our case, in our research, elementary students. So, however, in considering the benefits of individual and small group conversations, Hong's research found that PTSD symptoms in children were not associated with their quality of life or experiences with parental figures, but how their individual differences as children, as human beings, were taken into account when considering how to support them after their exposure to some sort of trauma. And so this research tells us that debriefing might be harmful rather than helpful because it generalizes the process of debriefing to assume that all children need or desire the same type of debriefing, when in reality, it must be a process that takes into account the different needs of children who have experienced, again, directly or indirectly, a traumatic event. And so there's also other supportive evidence, especially in Tuckey and Scott on that bottom bullet point, that suggests that group debriefing can be helpful for those dealing with trauma response. So in this research, they implemented CISD with emergency workers who shared an exposure to a potentially traumatic event. And they found in their research that CISD was not necessarily a preventative measure for post-traumatic stress or for PTSD, which is its primary goal, but there was supportive evidence that it accelerated recovery and helped them to return to normal functioning after the exposure quicker. Additionally, this research hones in and directs us to a possible future direction for the practice of group debriefing, minimizing the recount of trauma. So there were studies done on battle mind debriefing, which is reinforcing behaviors that adapt to experiencing trauma rather than recounting the trauma, in which CISD focuses on. So this research was done on former veterans after their experience in war. And this battle mind debriefing led to positive outcomes for soldiers who had greater exposure in combat. So these studies suggest that while CISD and other group debriefing interventions may not be effective in preventing PTSD or other anxiety or stress disorder symptoms, they can be effective in assisting those who have been exposed to trauma in returning to their normal functioning and discovering appropriate and individualized coping strategies.
So as Mary Grace was mentioning, there are varying studies that demonstrate that debriefing is effective and also isn't effective. So it's an ongoing debate, which makes it very challenging for people who are working in services that do directly work with people who have potentially experienced traumatic events, and educators do happen to be one of them. Because as Maria was also mentioning, you know, there is an influx of just traumatic events, especially gun violence and ongoing wars that are happening today in our world, and students and everyone is basically aware of them because of the media and just of everything that is happening. So it does become a conversation that educators have to think about, and especially with young children, it is difficult because there is varying research on how to talk about it with them, and honestly not enough research. So a lot more needs to be investigated for us to come up with best practices. However, we did find that from our research, there are some practices for supporting students after exposure to trauma that we believe are important for us to keep in mind, and for educators like yourselves to also be aware of in our world today. So one thing that we thought about together was how important it is to talk to your administration. we have to be aware of how our schools, our administrators, and our principals specifically want traumatic events to be addressed. It's important to know that we are all working together in our school and that a cohesive message is being shared to the students. So it's really important to just be open and ask your principal, your administrators questions, and just be honest about how it is difficult to talk about these things. And we need support and advice and direction from those who are running the school and who have more experience than we do at this point. Another thing to keep in mind is that we really need to know our students. I think that's in every aspect of teaching, right? We have to get to know our students well. But within these situations, we need to remember that it's very important to thoughtfully differentiate our approaches, which means that not everything is not something is not going to work for every single child. All children are different and react differently. So our approach has to vary. We need to, of course, be considerate in our language and thoughtful in our language. How are we speaking about these things? And anything in general to students, you need to be very aware of your language and realize that students will respond differently. Some students will want to talk about what is going on and have questions that they want answers to, which of course we won't always have answers to, but others will not want to talk about that, and it will cause more anxiety and fear within them. So we have to be aware that students respond differently, and differentiation is very important in how we teach and speak with our students. In a study, we found that they told us that interventions need to be tailored to the developmental levels of children. So like I said, all children are developing at different rates, and not one thing is going to work for every single student. So you have to be very aware of just the different developmental levels of children and that people will go at different paces. A third thing that we talked about for practice for supporting students is just to be aware that immediate debriefing, there are negatives that come with it, and we have to be very wary of it because of the lack of research still that exists or does not exist yet for the effects on children, specifically for debriefing. We have to recognize that there is so much research that needs to be done, and that's one of the main things that we came out of this study that we did, was that there needs to be more research, more empirical evidence that shows us the right direction in terms of speaking to students and just people in general who have experienced traumatic events. How are we supposed to go about this? What are the best practices? So we came to the conclusion that at this point, we should be refraining from bringing up traumatic events unless they are brought up by our students. Like we have mentioned, different students respond differently to trauma, and bringing it up with some students might be helpful for them to understand maybe the situation better or process emotions, but other students that will not be helpful. And there are many negative effects that research has shown us that come with immediate debriefing, especially. So we recommend, and what we are going to do for ourselves as well, going into our second year of teaching, is just to refrain from talking about the details of traumatic events and to let our students come to us. And it's important to vocalize to our students that we are here for them. We are, sources of support, and we will answer the questions that we can answer to the best of our abilities, and just to let them know that we are here to listen and to talk to them, but to more so refrain from bringing up specific details of trauma, because it could hurt students more than help them, especially because people cope with things differently.
So the question we're left with now is, what can we do? And so Kate really just went into this just now, but we wanted to expand upon this as well. So first, what we can do is get some further research done. As we mentioned, there's no clear answer as to the best way to discuss frightening events with children. So we need to learn more. And as Kate was saying, this can be learning about group debriefing with children specifically. It could also be using different strategies in classrooms and finding empirical evidence that one works better, one doesn't work as well. Really, when we were doing this research project, I think all of us were very surprised at the lack of information about talking about difficult topics in classrooms. Not even just like violent events, but like any difficult topics, there just isn't a ton of like research backed evidence about what practices to use. And so I think all of us were very surprised by that. And I think that this is a really great area for the psychology field to go into when it comes to education, because as we all know, there are horrible things happening every day, and kids are naturally curious and they know a lot more than I think they probably should sometimes. But they deserve teachers and educators who are willing and able to support them through learning about difficult topics. And so I think all of us would say, of course, there needs to be further research, and teachers need to have access to any research that's being done. In addition, I think another thing that we can do is really just trusting our judgment as educators. We all know our students, and when traumatic events happen, the best thing that we can do for them based on this research is to really see how they're doing and to put the students first, and just using our best responses or our best judgment in our responses to our students. It's not easy to have conversations with children about violence or current events that maybe we ourselves are really grappling with and struggling through. However, our students are looking to us as like beacons for how they should react to situations. And so I know for me personally, this year it was really difficult sometimes to be struggling with how to talk about things that had happened in the world with my students when I myself didn't know what was happening or didn't have a full understanding, or like couldn't put into words how I felt about it. It's a really big responsibility to be a teacher, as we all know, and we need to be there for our students, and we need to use our best judgment to help them through things. But some of that we can be supported, I should say, through resources that we've all found online. There are recommendations from medical doctors as well as just parents all over the internet about how to talk to your kids about current events. And so we know some of them are just making sure that you are dispelling any rumors that they may have heard, like ensuring that kids are having a full understanding of what they need to know, not what they don't need to know. And I know in my classroom, a lot of the times when current events came into discussion, it came with a lack of understanding about the nuances of some of them. So we had a lot of discussions about good media versus bad media. Like, can you trust all the sources you read? Is TikTok a reliable resource? Things like that. Like having those conversations with your students is beneficial for a lot of reasons. However, when it comes to those times when you do have to talk about a war breaking out or a shooting or something awful, you can start from a point where you are saying, okay, let's make sure we are understanding the media that we're taking in and that we can use it productively. And so we actually created a list of resources that give recommendations for how to have those conversations, but also when there is a difficult event, like specific steps to go through with students. And this is on a QR code on this last slide with our references. So this is a document with about 10 different resources that outline how to talk to children about violence specifically. Again, these come from medical doctors, from psychologists, and one or two comes from teaching resources. So like Scholastic is one of the sources. We definitely recommend, again, while we don't have a definite answer as to like the best way to talk to your kids about violence, these are really great resources to look at in those moments when you think that you might have a tough conversation coming up with a student or with your class, to look at and to reflect on yourselves as you navigate the best steps to take in your classroom. Thank you so much for tuning in, and hopefully we can avoid these conversations. Bye.